How resveratrol can improve your health. Resveratrol, used maximum for longevity. It is maximum use worldwide, only for increasing longevity, means increasing lifespan. Does it really works? To understand more, just come to its journey with us. Resveratrol, from grapes, for your health. Wonder molecule, evolved by nature, for protection of grapes, from fungal infections, ultraviolet radiation, stress, and injury. Resveratrol, and health. A very important key ingredient of red wine. A very powerful antioxidant. Belongs to polyphenols, stilbenoids group. This molecule is detected in more than 70 plant species. Its anti-cancer properties are so wide that it can inhibit all carcinogenesis stages, initiation, promotion, and progression, apart from possible cancer benefits. It's also anti-inflammatory, cardioprotective, vasolaxant, phytoestrogens, neuroprotective. Resveratrol. Distribution in nature. Resveratrol is not a single compound, but it is a group of at least more than 90 compounds, and that includes monomer, dimer, trimer, tetramer, pentamer, hexamer and also octamer. Chemically it's in two forms, cis and trans, as it is very normal. Both forms exhibit different bioactivities. Trans form also convert to cis form by exposure of sunlight, and trans form is more stable in air. Food rich in resveratrol. Red wine has a good amount of resveratrol, and that too. Wine out of thicker skin grapes has most of it, while white wine almost none. French Beaujolais contains 3.55 mg per bottle. California Pinot Noir contains 5 mg per bottle. White wines contains very little, only 0.20 mg per bottle. Grape juice much less than in wine. Only benefit is that it is free from alcohol, but at the same time, too much sugar. Grape juice from red grapes contains 0.5 mg per liter. Foods. Important source of resveratrol. Peanuts. In grapes it is only in skin, but in peanut it is in all parts of plant. Peanuts 100 g contains 1.12 mg. Peanuts 100 g roasted contains only 0.006 mg. Peanuts boiled 100 g contains 0.412 mg. Pistachios. It is surprising but true. Almonds, walnuts, and other nuts do not have this. Pistachios 100 g contains 0.11 mg. Cocoa powder, it's about half to. California red wine and much more. If we compare with peanuts, cocoa powder 100 g contains 0.185 mg. Food source of resveratrol. Strawberries. These are also good source. Also better than many types of grapes. Strawberries 100 g contains 0.35 mg. Black grapes 100 g contains 0.15 mg. Green and white grapes 100 g contains 0.02 mg. Jackfruit skin. Everyone likes pulp, but pulp and seed both have very little amounts. Skin has almost amounts very close to strawberries, but it is not very easy to eat. Jackfruit skin 100 g contains 0.356 mg. Blueberries. It has higher amounts than strawberries. Blueberries 100 g contains 0.385 mg. food, and resveratrol. Bilberries, it's very closely related plant to blueberries. Bilberries 100 gram contains 0.67 milligram. Cranberries, this is also closely related to blueberries. Cranberries 100 gram contains 1.92 milligram. Red currants, it has better than blueberries. Red currants 100 gram contains 1.57 milligram. Mulberries, this is almost outstanding. Better than red wine. Mulberries 100 gram contains 5.0 milligram. Resveratrol production. Most of the commercial material is produced from the roots of a plant Polygonal cuspidatum, also called as Japanese knotweed plant. This plant is available as a waste weed plant in lot of countries, mainly in South Asia Pacific. It is also produced by fermentation process using special strain of yeast. Resveratrol, how it works. Resveratrol might be expanding the blood vessels, and also it may be reducing the activities of cells in blood clotting. Some research suggests that it may be acting as estrogen, and thus creating a estrogenic effect. It's also acting as a very mild painkiller, and reduce swelling. Exactly how resveratrol might do all this is mystery. One thinking is that it might be turning on genes, which is responsible for making sirtuins. These are ancient proteins, which in turn activate a process which can prolong life. Endurance enhancement by resveratrol. What if you can enhance your results, and you can achieve your set goals? Endurance training is all about this. A study conducted over a 12 weeks period on rats, where they are given resveratrol. The study concluded increase in endurance, increase in oxidative metabolism, increase in cardiac function, and total performance increased by 21%. Resveratrol acts as a booster for testosterone. A research study concludes that blood concentration of testosterone was improved by more than 50% in 28 days period of resveratrol consumption. However, these findings are only on mice. More research is needed, that too on humans. Cancer and resveratrol. Research studies are carried out, and they confirm that resveratrol has anti-cancer activities. It reduces the growth of cancer cells. And other research studies confirm that resveratrol is a very potent chemoprotective and synergistic agent in cancer chemotherapy. Chemotherapy normally often suffers from many side effects, such as cardiotoxicity, hepatotoxicity, renal toxicity, easy recurrence, and metastasis. And here resveratrol provide great help. Coronavirus and resveratrol. Research studies appeared in May 2020 in medical journals states that a combination of resveratrol with indomethacin, and in another study, resveratrol with copper, seems to be very promising candidates for the treatment of coronavirus. Although initial findings are just great, still, a lot more work is needed, including clinical trials, to make it a success story. Resveratrol. Most popular use. Increase lifespan. Whether you believe or not, this wonder molecule is considered as a life-prolonging molecule. Most of the supplements are used for this purpose. Here everything is not myth. Experiments are carried out, and they suggest that it can increase lifespan at least 60% more. But most of this research is done not on humans, but only on lower animals, such as worms and fishes. Resveratrol. Bioavailability and absorption. Resveratrol is a typical case where absorption and bioavailability, there is too much difference. 25 mg oral dose results only in less than 5 microgram per ml in serum. This also causes worry. How to use it much better way. Also in morning time it's more bioavailable than in the evening or night. Food normally do not affect its absorption in intestines. Micronized resveratrol has 3.6-fold increase in bioavailability. Resveratrol. Health benefits. May lower blood pressure. Because of its very powerful antioxidant activities, it helps in reducing blood pressure. That too systolic blood pressure. May regulate blood fat. LDL, bad cholesterol goes down. In one research findings, in 6-month treatment, it reduces LDL 4.5%, and their oxidized LDL about 20%. It may protect brain, it slows down age-related diseases, and it is very good at it. Resveratrol. Health benefits. It may increase insulin sensitivity. It can provide lot of benefits. In diabetes, it reduces complications, may protect against oxidative stress, and related complications, may decrease inflammation, activate AMPike, this is a protein, which metabolize glucose in body, increase lifespan, as a very powerful antioxidant. It slows down the aging process, and this is the most important function, for which it became very popular. Resveratrol. Health benefits. Hay fever. It seems to be working in this case. Nasal spray containing resveratrol and beta-vulcans can reduce the allergic symptoms. In children, obesity. It seems to be working in this disease. Resveratrol and health benefits. Mental health. A combination of resveratrol and pterostilbene is more powerful and popular for mental health, aging, and longevity. Eye health. A combination of resveratrol with quercetin works very well. Skin health. Resveratrol is used in a lot of skin preparations as anti-aging, glow, and beauty benefits. Resveratrol with retinol, quercetin, curcumin, grapeseed extract, green tea extract, genistein, vitamin C, vitamin E, ferulic acid, glucan, these all are in market for anti-aging. Some of similar combinations are also promoted for weight loss. Resveratrol doses. For seasonal allergies, hay fever, 0.1% spray, 3 times a day, 3 to 4 weeks. For obesity, 500 mg per day. For cardiovascular health, 150 to 445 mg per day. For insulin sensitivity, 150 to 500 mg per day. For longevity, 250 to 500 mg per day. For cerebral blood flow, 250 to 500 mg per day. For aromatase inhibition, breast cancer, 500 mg per day. Resveratrol. Safety, side effects. It's very safe, even at very high doses. 3000 mg per day for 6 months. Does not show any side effects. Some people do complain about stomach problems. Precautions and warning. Pregnancy and breastfeeding. It's very safe. Children, it's safe. Resveratrol. Precautions and warning. Bleeding disorder. Resveratrol might slow down the clotting process, so careful. Hormone-sensitive conditions, such as breast cancer, uterine cancer, ovarian cancer, uterine fibroids. Resveratrol acts as an estrogen, and it can make the condition worse. so better avoid it. Surgery. It can increase the risk of bleeding, so stop at least 2 weeks before surgery. Resveratrol. Interactions. Some medicines are changed and broken down by liver. Resveratrol can increase the efficiency and side effects of these medicines, so care should be taken. Some of these medicines are lovastatin, ketoconazole, Allegra, etc. Medicines that slow down blood clotting. Here it can end up bleeding, so careful. Some of these medicines are aspirin, ibuprofen, naproxen, warfarin, etc. Very important. Although resveratrol is not a very reactive material, but still we don't have much research data about its bioactivities. There is a possibility that it may interfere in some way with the medications, if you are taking any, for your health conditions. So please, you must discuss with your doctor, so that you can get the best advice. Disclaimer. Although care has been taken to ensure that the information presented here is very accurate and up to date, still, the channel takes no responsibility. Information provided here with respect to diseases and treatment are only possible indications. No way they will be taken as an alternative treatment, and they are not substituted for the advice provided by a doctor or any other qualified healthcare professionals.